welcome to the Hans Brinker Leadership Series, Extraordinary Leaders in These Extraordinary Times by Adi Partners. I am Sanjay Viswanathan.
COVID-19, the pandemic of this millennium, has changed our daily lives irrevocably. People fighting this pandemic at the coalface in healthcare, travel, industry, government, non-profit, and media deserve recognition. I am Hiral Desai. Sanjay, we've had some amazingly insightful discussions on the show, haven't we? And an overwhelming response is what we've got from our viewers. So once again, I would like to thank all the viewers for watching us and following us.
Absolutely, Hiral. In fact, as we continue to identify extraordinary leaders in these extraordinary times and share world-class practices to combat COVID-19, and create a cohort of champions who can influence and energize this war against the pandemic. This series provides everyday leaders, like the one that you're going to be introduced to shortly, an opportunity to share their best practices with a wider global audience in their fight against COVID-19. And of course, this program takes us across the globe, from the UK to North America to Middle East, and then the Far East, and then to India.
Absolutely. In fact, in our previous episodes, we've spoken to champions from healthcare, non-profit, hospitality, and industry. Today, we have someone, yet again, who's from the healthcare space and an entrepreneur himself as well. Let me introduce you to Dr. Abdullah Albeyatti, graduated in medicine from Imperial College London in 2011. His clinical career started with ENT and he continued developing his skills in AE and finally embarking on general practice. His passion for innovation and problem solving has led to multiple solutions for clinical and operational challenges in the UK's NHS.
In 2016, Abdullah co-founded Medicalchain, initially as discharge summary, an application used in hospitals to generate accurate medical reports on patients before they're discharged. Medicalchain has now evolved to applications of blockchain technology, so healthcare records can be stored securely. By digitizing healthcare records, Medicalchain aims to empower patients, create comprehensive healthcare, and improve clinical outcomes. Delighted to have you on the Hans Brinker Leadership Series, Abdullah. Welcome to the show.
Hi, thanks very much for having me.
One of the things we've always been wanting to ask you is what motivated you to become a clinician, especially across primary and secondary care?
So what motivated me really is a combination of being involved in scientific research. So I've always been a keen scientist since I was a young student, and I've always been keen to speak to people as well. I like getting to know people, understanding how they tick, and trying to empathize where people are coming from. So medicine, to me, seemed like the ideal career choice. We don't actually have a lot of doctors in my family. My parents, my dad is an engineer, and my mother is an accountant. But they instilled in us a lot of morals and ethics and told us to always look after people and to use whatever learnings we have as for good, really. So in the end, my elder sister became a doctor. I'm a doctor. My middle sister is a dentist. And the youngest one is also a doctor. So they really influenced us in that sense.
Fascinating. And we all know the NHS to be one of the best clinical care platforms. One of the things we know from you is what sort of clinical and operating challenges do you face in the NHS?
Yeah, so the NHS is a wonderful organisation to be associated with and to be part of. However, it comes with its challenges. It's the fourth biggest employer in the world. It spreads over the whole country and covers a whole range of topics, anything from social care all the way to very cutting edge surgeries as well. And when you're trying to make that system work, there are places where it can drop the ball slightly. So the challenges are logistical, as well as trying to keep the workforce motivated to keep on delivering where demand increases year upon year.
Right. So, I mean, these have been challenges, where a lot of other doctors as well have highlighted to us Taking this into consideration, if you could just help us understand, Abdullah, how is the NHS aiming to improve patient outcomes in the era of COVID?
Yeah, so it's been a challenge. The NHS has been going through a turbulent time lately. We've had what we refer to as a winter crisis year upon year before COVID, where the demand is just outstripping the supply. And this results in hospital departments being overloaded, our accident and emergency departments unable to cope with the volume of patients coming through. And it's not helped that we now have COVID. So what the NHS has had to do is really strip away anything which can be postponed. Now, obviously, this has put a lot of pressure onto the patients, and as the doctors, it's our responsibility to be the advocates of the patients. So as well as trying to make them realize the difficulties that we face, we also have to challenge the system and say, but my patient really needs this, and really fight for their cause. So anything which can be delayed and postponed, we've had to do that because the system can't cope. But anything which we think is critical and important, for example, cancer care, we make sure we fight for our patients so that they get the right care immediately rather than having to wait with everybody else.
Right, so advocating for patients is something which has been really important at the NHS as well. With this journey, you then created discharge summary and then Medicalchain. Tell us the idea and the story behind you turn.
I mean, the truth is I stumbled into it. It was never a passion or an ambition of mine. I think I was lucky, and my dad always taught me the definition of the word luck. He said it's when opportunity meets preparation, and I think that's exactly what happened here. I was prepared because I had the skill set to lead a team, to be part of a team, and I had a clinical background, and I've always been interested in business, and the opportunity came along with my idea discharge summary and how that eventually evolved into Medicalchain. So discharge summary, very simply, is when a patient is leaving the hospital, we must complete a document called a discharge summary, which summarizes clearly why they came to hospital, what investigations were done, what we found, the diagnosis, and the aftercare. The quality of this discharge summary really varied from clinician to clinician and from department to department. So as a GP, as a general practitioner, when you're accepting the patient back into community from the hospital, 2 patients could have had serious heart attacks. One's only had 4 lines written about them, the other one's had 4 pages. So I made this website with some help from some family members called dischargesummary.co.uk, and it was simply a document where you would click for a few boxes, like a macro document, if you will, and then that's how you'd come up with a nice template at the end. So this is something which I did completely for free. It spread throughout my local area, which is Leeds. It also went down to London. So the University of Lewisham Teaching Hospital used it, Queen Elizabeth, Princess Royal, and different departments started coming forward saying, you've done this in cardiology, but please can you do it in our sectors as well? It was at that point that I realized that this is something which I'm very interested in, I'm capable of delivering, and my limitations were the team around me and the skill set around me, because I'm not a coder, I'm not a programmer, and this is very a basic level, but it was already quite difficult for me, and obviously funding as a company. So I spoke to my family member Mo Tayeb, who's my co-founder at Medicalchain, and before this he's a successful entrepreneur himself, and he's exited a few companies successfully. And I told him, Mo, this is what I've been working on, this is where I got to, I really could do with your help. Thankfully, he saw the potential, and we put together Medicalchain. And Medicalchain, the premise of the company is to empower patients to have access to their medical records so that they can open up patient choice, remove healthcare barriers, and really empower patients to take control of their health. So this is something, as you say, we started in the 2016-17 timeframe, and thankfully we went on to raise $24 million. We have an office in London and one in Switzerland, and we continue to provide digital solutions to help patients first and foremost.
Fascinating. How is Medicalchain looking to revolutionize healthcare?
So I think that's a key word, and unfortunately in our sector the word revolutionize or disrupt is used quite commonly and it's thrown around. I think with what we're trying to do, it is really trying to revolutionize or disrupt things. And I say that because the way medicine is practiced in the UK, which is quite a template for the world, is that the patient would come to their clinical appointment, see me, the doctor. I'd look onto my computer screen and tell them what I can and can't see about them. And it's very frustrating for the patient when they say, you know, can you not see the medicine I was given yesterday by another doctor in another department? I say, if it's not on my login, I can't see that, I'm sorry. And sometimes it can be dangerous when the patient says, in accident and emergency last month, they gave me a medicine allergic to it. Do you know the name of the medicine? No, I forgot its name. Well, I don't see it either. So we'll play Russian roulette and maybe I'm going to give you the same thing again. I'm not sure. So we really want to disrupt healthcare in the sense that I don't like this relationship where the patient is at the mercy of what silo of information the doctor has. I think we need to disrupt healthcare and make the patient be the conduit, which is bringing their information with them from appointment to appointment. We all have smartphones now, so why is the patient not coming with a smartphone, with a QR code, scan my code, this is my entire medical records. And when the doctor adds information onto that, it's immediately saved onto their records and they can take that information away with them locally, nationally or internationally.
And when you think about blockchain technology, how do you view that in the context of the two most important things in the world of healthcare, i.e. improving clinical outcomes and highlighting patient experience?
Yeah, so blockchain for me is just simply a technology. It's like if we were talking about how do you see the internet in facilitating this video call? It's a tool which sits quite well with what we're trying to do. So blockchain gives you an immutable record, an audit trail, if you will, of the information which is being stored on this database. So the idea is when the patient is coming with their medical records and we know this information has been authenticated and could have only come from an original source, such as a clinic or a hospital or a pharmaceutical company or an insurer or researcher, then when the patient is showing that information to a clinician, the clinician can be confident that there's no way the patient could have edited this, written this, deleted this, missed out information, and the blockchain is going to secure the quality of that database going forwards. I think if you have a quality database which a clinician can work through, we can only give you the diagnosis or what we think are appropriate tests or treatments based on the information in front of us. If you don't tell me you smoke, I'm not going to think of different differentials. So the more information I have, the more accurate a delivery of care I can do for you. So I think this is how it's going to help with the patient outcomes. And I think also in a kind of research or insurance company, all the time, unfortunately, they bypass the user, which is the patient, and they go directly to the source of the information, which is the clinic or the hospital. It's not ethical, it's not transparent, and the patient whose data is very valuable is being completely sidestepped when they should be financially rewarded if somebody is going to be working off of their data. So again, if you empower the patient to be the center of their care, as an insurer or researcher, I'm going to go directly to the patient and say, I know the access to data you have is identical to what the hospital has, and we can prove that on the blockchain. So can I financially incentivize you to give me access to your medical records for 1 week? Can we have a financial arrangement where this is your health insurance quota for the year, and if you bring your blood pressure down, then we can reduce what your liability is going to be as well? So really it opens up all these opportunities if you make the patient the center of the care, and if you make sure that the patient has the identical quality of information that you'd get from any hospital or medical records.
Right. That's an interesting aspect that we're looking at, Abdullah, overall. Now, if you talk about Medicalchain from here on, what is the plan? What is the strategy for growth, especially in this pandemic-fueled era, where economic hardship is something which is acute?
Yeah, so it's been very challenging for everybody, obviously, during this COVID times. In terms of healthcare or health tech, it's actually been a booming time for us because of COVID-19, which has accelerated certain features or certain technologies which clinicians, unfortunately, were very pessimistic about. So one of those is, for example, video calling or doing telemedicine consultations. So as a company, we were building a digital outpatient solution. So the idea that the patient could interact with doctors, view their medical records, and also facilitate a video call. So on our journey to producing this product, we realized we have to do our bit for COVID-19 as well. And our chief technical officer, Bara Mustafa, came up with the idea of a virtual waiting room. He said, why don't we just have patients come into a virtual waiting room and the doctor can pick at those patients and start a video call with them. And the system is very simple. The patient's given a unique 6-digit code. They land on our homepage, myclinic.com, put in the unique 6-digit code, and then they're in the virtual waiting room waiting for the clinician to join them, as you would in a waiting room waiting to be called by the doctor. So this is something where we used our learnings and we did it completely for free. We're very privileged in the UK that we have about 4 or 5 reputable telemedicine companies which can deliver this service, but worldwide, especially when the doctors have been told to self-isolate or the patients have been told to self-isolate, there's been a massive breakdown in communication between patients and doctors. So we offered our solution completely for free, and I'm pleased to say that it's being used in over 72 countries today, especially in some of the poorest areas of the world, such as in the continent of Africa. We have huge growth there and a lot of clinicians using that to stay in touch with their patients. So something which we're very keen to keep for free. We'll never charge to use our basic service. But now we've had such good traction there, we're going to try to commercialize premium features such as screen sharing. So if you have a database and you can see the patient's blood test results, I can share my screen directly with the patient and they can see where I'm highlighting what their blood sugar levels are like or their thyroid or whatever else it may be. So we're going to push on with that product, push on with those features, but we'll always have a free feature there so that we can support people around the world who aren't fortunate enough to have a telemedicine solution.
Right. So that's the plan with regards to where Medicalchain goes, Abdullah. However, when you look at growth from here on, where do you see Medicalchain, say 2 to 3 years down the line, taking into consideration right now that, yes, companies are struggling on the back of COVID. However, what's happening is companies like yours who are coming up, providing solutions like this, providing employment as well in turn. If you have to look at a growth path from that perspective, how do you see Medicalchain growing from here on?
Yes, I think it's really going to depend on what happens in the future of the world, and it's very hard to predict that. I think what we're seeing, even outside of COVID, is a new culture of health tourism, and the idea that patients want to seek opinions from different clinicians around the world. You might have a Chinese patient with a knee injury who wants to speak to the world's best knee surgeon who's based in America. Now, the difficulty is how do you facilitate that consultation? How does the Chinese patient show the American doctor their MRI scans of their knees, the clinical opinions they've already sought in China? How are you going to facilitate those payments between those individuals as well? So this is something which I hope we'll be able to build into in the future going forwards. We're very fortunate that as a doctor working in the NHS, I've got a great test bed in front of me to really see how the system is going to work, especially in such a stringent IT system as we have in the NHS. If you can match their GDPR levels of compliance, their information governance, this is normally well above what is expected around the world. So we hope we can make good traction here in the coming year or two, as well as trying to expand worldwide so that we can get better traction in the Far East and the Middle East, for example, where health tourism is encouraged and where patients do seek a better quality of opinion sometimes.
Right.
Incredible, Abdullah. So I think, when we think about how in this new normal, as we all call it, healthcare is clearly one of those industries that's changed dramatically and will continue to change even more. What is the sort of impact that you and Medicalchain would like to leave and create in this industry?
So I saw a homepage the other day on the internet. There's a system or a software called WordPress, which I think most of your listeners would have heard of before. And essentially, they said a third of the whole of the internet is built on WordPress. And I thought that is such an amazing achievement to have such a simple tool that most people turn towards. And I thought that'd be an amazing legacy for Medicalchain if we could become the normal operating system for medical interaction, so that a third of all the consultations that ever happen in the world happen via Medicalchain. Rather than opening some kind of software you've downloaded on your computer, you'd open your web browser, your Google Chrome, your Firefox, whatever it may be. You'd go to myclinic.com and you'd start your consultation from there. And that would be the default way to interact with your patients. So that's something which is obviously mile high thinking or star studied gazing, but that's something I'd love us to achieve in the coming years.
Right. And with this, Abdullah, I'm sure, being both a doctor and an entrepreneur, there would have been some challenges or the other. What advice would you give to students and doctors who are interested in becoming entrepreneurs. I mean, what skills should today's students, probably early or mature, be learning to be successful in this new normal, taking experiences from your own challenges?
I mean, there's lots of advice I could give. I normally lecture at universities or at different royal colleges to give advice to the upcoming junior doctors coming through the system and trying to encourage them and inspire them if I can. And I always offer to be contacted by them via LinkedIn, and sometimes I can mentor a group of students at a time or a group of doctors at a time. The common theme that I normally tell all of them, however, is you must value yourself. In a system such as the NHS, as fantastic as it is, you do enter this kind of conveyor belt of training. You know, you did your secondary school exams, you went to university, you're now a junior doctor, you're now on the wards, you're now a consultant, and you become very focused on this career or this trajectory of being a doctor, like this pathway has been set out for you. And I always try to encourage the students and the doctors, think outside the box, value who you are. You're learning so many skills along the way, communication skills, which we might take for granted. A lot of the rest of the population actually struggle with brevity or to get their point across. And this is a skill you've picked up over time. Think what a great communicator you are. Think about how you might not be the brainchild of the idea, but you could work with somebody who's a genius, but just doesn't know how to get their idea out there, doesn't know how to present it, doesn't know how to win a pitch, for example. So I'm always trying to encourage the junior doctors to value themselves, look at their different skill sets, and try to think outside of the box. You could be a surgeon and injure your hands tomorrow. That's the end of your career. So you always have to think going forward, what other value do I have that I can give back to an industry such as business? And for me, it's been massively rewarding. Not so much the financial side, but more, you know, I would never have met people like Sanjay. We would have never come across each other. I would have just known my patients in my local clinic and driven to the car park and back every day for the next 40 years. And it's been a fascinating journey for me. And I'd really encourage people to try to get the most out of their degrees by really challenging themselves.
That's really amazing, Abdullah. You're such an inspiration, not only for your generation, but also for the wider community and the fraternity of clinicians. So once again, thank you for being on the show. That was extremely insightful. And congratulations on being part of the Hans Brinker Leadership Series as a cohort of champions. Welcome.
That's very kind of you. Thank you very much for having me.
Thank you so much, Abdullah, for being there. And indeed, Sanjay, that was remarkably an insightful peek into how doctors can even adorn the entrepreneurial spirit, creating impact in today's society and industry. In fact, I'm sure we're excited to discover and explore more in the journey of the Hans Brinker Leadership Series. Thank you all for tuning in. Sanjay and I will be back to share more extraordinary leaders in these extraordinary times. See you soon.